And we're live. This is not live. This is my first veteran news segment. I watch videos like this.
This is how
and this
streamlining
and this.
It's done.
Worst case scenario, if it doesn't happen, the choice card's running out of money. You mentioned there's money to backfill it.
Actually,
if
in
it
2
doesn't
weeks,
pass.
Dan, if it doesn't pass in 2 weeks, the choice is out of money. 1st of June.
So you don't have to. To start a news series on anything veteran, you've got to start with the revolving door of the VA secretary. Once I catch you up on that, I'll explain the Cerner deal, the Mission Act, and how it all relates to us as veterans. Plus, tune in till the end for all the good news. Okay, so I'm just gonna go back to May of 2014. The reports came out of the VA wait time scandal. If you don't know anything about the wait time scandal, let me tell you. They had separate lists for what the VA actually used at their hospitals versus what they were reporting, and people were dying because the misleading of VA officials.
Many across the country. It's totally unacceptable. Last week I said that if we found misconduct, it would be punished, and I meant it. And a few minutes ago, Secretary Shinseki offered me his own resignation. With considerable regret, I accepted.
He'd been Secretary of the VA for 5 years. After his resignation, President Obama selected Bob McDonald. The Wall Street Journal called Bob an outsider because Bob worked at Procter & Gamble for 33 years and he served in the Army for 5 years. It only took Bob 8 months before...
I made a mistake, and I apologize for it.
And then another few months before...
When you go to Disney, do they measure the number of hours you wait in line, or the number, what's important? What's important is what's your satisfaction with the experience.
Did he just compare Disneyland to medical care? Not only was Bob wrong because Disney does measure wait times, but Disney isn't the VA. And I don't know about you, but I hate waiting in lines. I'd say it degrades my experience just about anywhere. Bob. And this all happened in May of 2016. He didn't lose his job. He kept working. Paul Ryan tweeted something scathing about it, but nothing really happened for over a year. When President Trump was inaugurated, Bob lost his job. The seat was vacant for a little while, but David Shulkin was ultimately tapped. There wasn't much of an explanation as to why Bob was let go, because both Bob and David disagreed with the privatization of the VA. When Dave took office, the Big Six were stoked on his selection, even though he's not a veteran. I think it's because everyone knew Dave wasn't gonna take us into privatization. Privatization has been the main subject on people's minds over the past few years. Dave and Bob both have said,
I just don't see privatization as a good thing for veterans. And I think that those that are really sticking to a political ideology or doing this for other reasons, like financial reasons, don't have the interests of veterans at heart. And I think you just have to talk to the veterans groups to hear that.
Dave was really listening too. In his first year, he was really making moves. Then,
this was a meeting that's been going on for 43 years that every VA secretary has attended, with 40 hours of interaction with our allies who fight all the wars together. And the only government expense was a single coach airfare for my wife, who was invited to this conference. She's a physician, and that was approved by our ethics department. Everything was done exactly how it should have. 6 months later, the Inspector General found that a staff member had not done the paperwork correctly, and when that report came out, I paid every penny of that coach airfare back. So I think that this was really all about the politics and really not about the substance of the issue.
I can understand why he would say it's about politics and not about the substance, because he kept his job for nearly a year, and at the time of the report, he wasn't even allowed to make a public statement. He kept his job, so he kept quiet. And then a year passed, Trump tweeted, "I'm pleased to announce that I intend to nominate highly respected Admiral Ronnie L. Jackson as the new Secretary of Veteran Affairs." And that's how David Shulkin lost his job. He didn't even get a formal anything. And then he started making public appearances so that he could explain his side of what went down. Ronnie Jackson was the White House physician, got nominated for the VA secretary position, and then after he withdrew his nomination, he actually went back to the White House at a lower position. Ronnie just wasn't ready for the level of scrutiny that the media or Congress were gonna put on him. Drunk on the job, drinking and driving, handing out pills like candy. I can't really hate on him because I feel like that's kind of the military culture that I grew up in. At the same time President Trump was tweeting Dave Shulkin out of a job, he tweeted Robert Wilkie into interim secretary of the VA. But eventually, after the Ronnie Jackson incident, he nominated Robert Wilkie to go from interim to full-time secretary of the VA. So now you understand how the VA secretary position has been a swinging door. Luckily, while the Ronnie Jackson fiasco is going on, interim secretary of the VA Robert Wilkie was completing the $10 billion 10-year Cerner deal. 10 years, $10 billion. At the end of those 10 years, you should be able to separate from the military and move directly into the VA system and never have a lapse in medical coverage. The Cerner deal was already in the works. Robert Wilkie actually just finished the deal. If you look into the system that they're implementing, updating to
the same electronic health record as the Department of Defense. So we will now have a single system. That system is known as the MHS Genesis system, which at its core is Cerner Millennium.
The thing is, the system that he's talking about has been tested, and it sucks. The DoD has been using it for a little while now, and the results?
Some of our challenges have been greater than others, and unfortunately has affected access to appointments for a period of time. However, our hospital and branch health clinics are coming back to normal operations as issues are worked through. To offset longer pharmacy wait times, we encourage beneficiaries to use the TRICARE Pharmacy Home Delivery Program.
Oh, listening to that guy talk makes me so happy I'm not in. Okay, maybe it's not so bad, but it's definitely problematic. Grandma, what are you growling at? Plus both Bob McDonald and Dave Shulkin both said that the change that needed to take place was so comprehensive, it would take nearly a decade. So this is really giving the system and the VA the time that it needs to really improve and streamline everything that they're doing. There's no separating the Cerner deal from the Mission Act and the Mission Act from the Choice program. And really, it's all for progress. I forgot to tell you about the Choice program. After the 2014 wait time scandal, they implemented the Choice program. Initially, the idea was to give every VA enrolled veteran a card entitling him or her to use community care at the VA expense when necessary. The projected cost turned out to be so enormous, lawmakers added last-minute cost controls. Those controls were,
as a veteran, you may be eligible if you have been told by your local VA medical facility that they are unable to schedule an appointment for care within 30 days of the date your provider determines you need to be seen. Your current residence is more than 40 miles driving distance from the closest VA medical facility. You need to travel by air, boat, or ferry to the VA medical facility closest to your home. You face an unusual or excessive burden in traveling to a VA medical facility. Or you live in a state or territory without a full-service VA medical facility. To find out your eligibility,
they put on restrictions that ultimately caused a lot of confusion, and responsibility for scheduling appointments, transfer of medical records, and payments of fees relied heavily on third-party contractors, causing delays and complaints. And that's where the majority of the issues lie, in the third-party contractors. The Mission Act and the CARE program will hopefully do much better than the Choice program. It actually streamlines paying, whether it be doctors or reimbursing veterans for medical services, and hopefully takes the third-party entity out of it. Time for some good news! Time for some good news! Woo! Well, I need one of those. That one.
The caregiver bill, where a catastrophically injured veteran can, and their spouse or a loved one may give up their career to take care of them in the home. There's a stipend for them, and that's for the post 9/11. But pre 9/11, I'm a Vietnam era guy. It didn't apply to us. So now we're going it won't happen immediately, but within a period of the next 2 to 4 years, we'll extend that benefit, to those veterans pre 9/11.
The good news, right now, more than 100 veterans are running for office to fight for change that they see in their community, whether that's congressional, all the way down to local, county, mayors, all of it. 100 veterans right now across the country. That's pretty remarkable. Another piece of good news. Cerner seems to be confident that in the next 10 years, everything will be digitized and they will be handling not only the DoD, but the VA. But that's already in the works. So Cerner is probably just trying to appease us. I can't really be sure. Another piece of good news. North Korea has released 3 US citizens back to the US. Last but not least, like, subscribe, comment, everything. Do it all below, do it over there. Check me out, Regular Veteran, Twitter, Instagram, YouTube. Boom. Go follow me,